Okay. So, muli po, ipagpapatuloy natin ang ating topic, interconsumption 2. Interconsumption, yang consume yin. Yan po yung example number 3. So, makikita po natin sa first drawing, alcohol increases liver yang. Yan, pag umiinom po ng alak, tataas ang liver yang. Tapos initially, liver yin can increase. So nasa healthy stage ang pag nasa healthy stage pa ang katawan, so pag tumaas si yang, hahabol si yin. Kaya yun, nagkakaroon ng hangover, na pakiramdam na mabigat, tamad gumalaw, dahil tumaas din si yin. Then, pagkatapos po nun, in due course, liver yin is consumed. So, habang tumatagal, nako-consume si yin. So, causing symptom of contractors of muscle and tendons. So, nagkakaroon na po ng problema, So, may mga paninigas na nararamdaman yung ating muscle and tendon kasi nga bumaba na si yin. Yan, nagkakaroon ng tremor, dry eyes, lack of control over anger. Biglang magagalitin, kaya di ba mga umiinom talagang maiinitin ang ulo. Yun. Nagda-dry eyes na po kasi di ba si yin, siya yun yung si blood. So, nagkakaroon ng dryness dahil wala na, bumaba na. So, pag nag-deficient liver yin, cannot control the rising liver yang. Mahina na siya kaya hindi na niya makontrol yung init sa katawan. So, liver yin stores blood. And when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of liver cirrhosis. Yun po yung nangyayari. Pag masyado nang mababa ang ating yin sa katawan, nagkakaroon na ng mga pagdurugo. Pwede rin pong example dyan yung mga, di ba, yung nag-liver blood deficient, nagkakaroon ng mga parang mga patsi-patsi sa katawan. Yun, lumalabas na po yung blood sa blood vessel. A reduced state of blood and chi at the end of bleeding. So, pareho na siyang bababa, mawawala na sa normal level. So, mas matindi na yung nararamdaman ng pasyente pag ganyan na. Mababa na yung yin, mababa na rin yung yang. So, ang gagawin po nating treatment, syempre una, sedate liver yang and tonify liver yin. So, ano ba yung mga points na magaling mag-sedate? Syempre, pwede tayong pumili. Halimbawa po sa liver, kunin natin yung fire points. Fire points po ng liver is liver 2. So, para eliminate niya yung fire. Tapos, tusukan din natin ng liver 3 kasi earth point 2 para itonify niya yung liver yin. So, pwede po natin gamitin yon. Points to hold the blood within blood vessel. So, function po yun ng spleen siya ang nag-hold sa blood within blood vessels. So, gumamit po din tayo ng pampalakas ng spleen. Pwede po tayong gumamit ng spleen 3 kasi earth point po yan. Papalakasin niya ang spleen. At dahil related din po sa blood, pwede tayong gumamit ng mga special points for blood. Ano po ba yun? Di ba yung bladder 17 and spleen 10? Yan, mga makakatulong po para matoni pa yung spleen at maging maayos yung yin or yung blood. Tapos pwede rin po tayong gumamit ng other points against alcohol abuse. So para hindi siya pabalik-balik na nag-iinom. Kasi kahit itonify mo yan ng itonify, pero pag lumakas, iinom na naman, babalik po uli yung problema. So magaling din pong gamitin sa alcohol withdrawal yung mga natin points sa tenga. So po tayo, magtusok tayo sa tenga or pwede nating lagyan ng seed. So yun, mga liver points po pwede natin lagyan, spleen point. Okay po. So, interconsumption, yin consume yang. O ito, kabaliktaran naman po ito. Kabaliktaran po ito nung kanina. Example number 4. Ang tumataas naman po dito si yin. So, firstly, cold or damp exposure over a period of time. Initially, yin increases. Halimbawa po yung nagpapaulan, nagsusuot ng damit na basa, nasa aircon lagi, kumakain ng malalamig. Yon, kumakain lagi ng mga salad. Yun po, tataas po yung yin ng katawan. So secondly, the yang rises causing symptom of inflammation or fever. This should be pathogenic yang. So tulad po uli, dahil nasa healthy level pa, lalaban uli si yang, tataas din siya. So magkakaroon ng mga sign and symptom ng inflammation. Pwede rin pong example dyan, di ba, yung pag nagtotonsillitis, nag-chill and fever, tapos may inflammation, tumatas po yung yang doon. So thirdly, the functional qi or the good yang is consumed. So yung qi natin, dahil nakikilaban siya pero malakas ang pathogenic factor na nasa katawan, yung sanhi ng sakit, matatalo po siya. Ayan, bababa. So, ang magiging ano po niyan, cold and damp exposure consume, warp, and inhibits functional yang qi. Matatalo si yang qi. So, harmful heat inflammation. Ayun po makikita natin ano. Tapos yung good functional yang natin, bababa. Ang tumaas yung pathogenic factor na heat. At saka yung pathogenic factor na cold. So, in case of an inflammation, the pathogenic heat remains high. So pag may pamamaga pa po, yung pathogenic heat ang mas mataas pero yung functional yang natin bumaba. So this is slowing of function yang qi deficiency caused by long-term cold or damp exposure. Pag matagal na po tayong na-expose sa mga lamig, yun po ang nangyayari sa katawan. Enter yin consume yang, example number 4. So, ang treatment po natin yan, kailangan itonify si functional yang. Palaksin po natin yung yang ng ating katawan or qi. Kasi di ba si qi ay yang. So, napakaganda pong gamitin ang bakshu point and low connecting points. Yung mga bladder points po natin, ano, bladder 13, bladder, basta lahat po yung bakshu pwede natin gamitin. Tapos, sedate mo si yin, pababain mo si yin. Yan. If the heat or inflammatory symptom do not disappear, add bloodletting or electrostimulation locally. So marami na po tayong napag-aralan, ano, yon. Mga check point pwede po natin gamitin. Halimbawa, sobrang init nung lungs, may tonsillitis, nakitang-kita natin yung pulang-pulang tonsil. So pwede po nating paduguin ang check point niya, lang 11, kaya may bloodletting. Pwede rin po nating i-wet cupping in order to either eliminate or disperse the heat. So yun ang isang pamamaraan. Dahil nga yung heat, ang pamamaraan ng katawan ay alisin ang heat at si blood laging nandun yung heat. Kaya kailangan nating palabasin yung heat sa pamamagitan ng bloodletting. Okay. So yin consume yang, example number 5. Cold increases kidney yin. Yan, pag ganyan naman po nagbabad ka sa tubig. Tapos tataas yung cold, ang maapektuhan ay si kidney. So lalaban uli si yang. The yang increases causing fever. So magkakaroon ng fever. Tapos arthritis, backache, ear infection, yellow nephritis, cystitis, etc. This is a definite history of exposure to cold, and the patient continues to feel very cold, even with the fever. So kahit may lagnat po siya, talagang nararamdaman pa rin niya yung panlalamig. So inflammation yang pain, pag may mataas po si yang, so nagkakaroon ng fever. Si functional qi, ito yung good qi natin na yang ay bumaba, ganyan pong nangyari. Lastly, the functional qi goes down while the infection pathogenic yang is still present. So mahina yung ating yang, pero yung mga pathogenic factor na nagiging sanhi ng sakit ay matataas at malalakas, kaya nararamdaman po natin yung fever. Okay po. So enter consumption. Symptom of qi deficiency, stiff joints, poor flexibility of back, loss of hearing, water retention, incontinence. So pag ganun pang mararamdaman yung paninigas ng mga joints, mahirap gumalaw, masakit yung likod. Tapos yung di ba marami pong nakakaramdam na kaiihi lang, parang hindi naubos, hindi lahat lumabas yung ihi, parang natira dun sa kanilang pantog. So a continued state of inflammation will inhibit the normal functional qi. So, talagang pag napiprevent yung functional qi natin na mag-function, pag matagal na po yung mga nakapasok na pathogenic factor sa katawan o yung sanhi ng sakit. It is always the healthy yin and yang that are consumed, not the pathogenic energies. Dahil nga lumalaban yung yin and yang natin, nagagamit, kaya sila yung nako-consume. At karaniwan, natatalo. Kaya napakalaking tulong pag ina-acupuncture para lumakas ang ating mga yin and yang o yung mga functional chi natin. Yun po yung role ng acupuncture. Tulungan silang lumakas para matanggal po yung mga pathogenic factors na pumapasok sa katawan. So yung treatment po natin, urinary bladder 23, ito po yung back-shoe point of kidney. So which activate function, palalakasin niya yung ating kidney para expel niya yung mga cold na pumasok sa kidney. Urinary bladder 58, low connecting point po of urinary bladder. So yun, palalakasin din niya yung urinary bladder para mawala yung mga retention, water retention, incontinence. Yung parang umihi ka na, pero parang hindi na ubos. Yun. The patient should be advised to keep warm, although no moksha should be used. So kailangan pag ganyan po maraming cold, siyempre papayuhan talaga natin yung pasyente na kung kailangan magmedyas siya, mag-jacket para mag-recover, mag-warm yung body. Bleeding cup to eliminate pathogenic heat. So, pwede po natin gamitin yung wet moxa, wet cupping. Yun nga yung nag-eliminate ng heat dahil may bloodletting. Electro-stimulation to disperse heat can be used in local areas only if necessary. So, yun po yung ating enter-consumption. May dagdag po, may tanong?
Questions po?
Po?
Okay, I'm afraid wala po. And then, tutuloy na tayo na sa next topic. Okay, ang next topic natin is completely cracked tongue. So imagine natin ang tongue na super dami ng cracks, no? Ano ba ibig sabihin nun? So we have a unique type of tongue, which is the completely cracked tongue. These are deep, wide cracks that are always located sa edges and sides of the tongue. Okay, pag sinabi mo completely cracked tongue, so nasa sides po siya, masyadong wide, no? Edges and sides. Despite its startling appearance, wala po siyang particular disharmony or pattern associated with this type of tongue. It often occurs in more than one family member. The cracked tongue may actually point to constitutional weakness and deficiency of fluids and kidney yin. So this is nothing to be so worried about, no? But all it tells us is that meron pong constitutional weakness yung pasyente and deficiency of fluids and kidney yin. Sa completely cracked tongues, kaya nakikita natin yung sides pati edges, the tongues are usually big and swollen. So, iti-check natin yung tongue color. Pag pale po, ano naman natin pale, no? Blood deficiency po yan, or fluid deficiency. Pag red, and then completely cracked, it indicates deficiency of yin and fluids. So, either way, it could be pale or it could be red. So pag pale, deficiency of blood and fluids. Pag red, deficiency of yin and fluids. Kasi ito po yung worst case scenario, no? So pag nag-red na po yung tongue, super init na. This type of tongue has very little coating or no coating at all. Bakit? Kasi wala ngang fluids. Kulang ang fluids. So a person with this type of tongue, hindi dapat masyadong matakot. It does not necessarily have, it doesn't necessarily mean na meron po siyang serious organic illness. Kaya rejoice. Let's go now to cases. We only have one case. We have a 42-year-old male. So syempre yung example natin yung completely cracked tongue. So here you could see a tongue that is pale red, tapos may reddish patches. So, doon pa lang, alam na natin, could be blood deficiency or yin deficiency. Meron po siyang thin vertical crack with horizontal cracks. Reddish tip. Symptoms, foul-smelling diarrhea, flatulence, plum pit filling in the throat, para kang may nararamdaman na seed sa lalamunan, burning of the tongue, and tiredness. Okay. Wala pong Western diagnosis, so DEDMA. Pero kung titingnan natin yung background niya, may kinalaman po yung overwork, emotional problems, and constitutional weakness. So as we have learned earlier, pag pale, ng daming cracks, medyo malapad siya, it's blood deficiency with heat developing. Kasi kung if you observe closely, the tip is reddish, no? Nagde-develop pa lang yung heat. And there is slight stomach yin deficiency. Slight because the crack is not, hindi naman that no? Hindi na ganun kalalim. Spleen qi deficiency with the onset of spleen yin deficiency. Itong spleen yin deficiency, nakikita niyo yung cracks na horizontal from the center. Yan po yun. And heat in the heart due to the fact that we have reddish tip. Any questions?
Dok, may kaugnayan din po ba yan pag sa yung Jing essence niya ay very weak din?
Yes, definitely. Oo. Diba, Jing, but it doesn't necessarily, maglalaman mo naman kung naubos na yung, or very weak na yung kidney essence niya. Kung wala na siyang buhok, he looks older than most people. Kasi there is such thing as, syempre, magsisimula mo na siya kidney deficiency. So kung superheat na, yun, nag-iba na yung anyo niya, that's the time we say, meron na po siyang kidney essence deficiency. So obviously, we are looking at a parang starting signs. Kasi pag hindi ito iningatan, you look older than your age. Diba? So early pa. Kasi yung tongue natin na nakita is still pale. So it's not really that serious yet. Nag-i-start pa lang yung heat.
Po, pag pinabayaan po, magagamit lalo niya yung Jing essence niya. So,
yes.
pwedeng hindi umaba ang buhay.
Kasi saan pa siya kukuha? Doon siya makukuha sa Jing essence. Sa essence. Diba? And if you notice, ang pangit nito, makikita mo talaga, diba ang kidney and heart, they have a very mutual, they have a relationship, controlling relationship. Kailangan po ng heart ang kidney, yin, para po hindi po siya tuluyang mainit. Ang problem dito, meron nang kidney yin deficiency. Diba? So, hindi talagang pula yung heart area. Diba? So if you see cracks, the first thing that you have to bear in mind would be, is it pale? Okay, sorry about that. We had a little technical problem. So I hope, sige, laban lang tayo. Tuloy pa rin. Okay. May I request Ma'am Mildred to take over sweating? Classification of sweating. Thank you po.
Sweating. Classification of sweating. So, tingnan po natin at iba't ibang uri ng pamamawis. Classification of sweating. One must distinguish sweating according to the area of the body. So, kailangan alam natin, nasang part. Time of day, pati oras, condition and quality of sweat. So, napakalaga po nun. Area of the body, only on head. Pag nasa head daw po, heat or damp heat in the stomach. Yan. Pag nasa head natin nakita, si stomach. Heat in the upper burner, deficient yang, floating upward retention of food. So, yun po ang ibig sabihin pag nasa head ang pawis. Only on hands and feet. Deficiency of qi or yin of the lungs or heart and kidneys. Ayan, yung mga namamawi sa kamay. So, ang nagdi-deficient ay lungs, heart, and kidney. It's also be due to heat in the lungs or heart and kidneys. So, pag yan tatlong organs po yan ay may heat, nakakaranas tayo ng pamamawi sa paa at kamay. Tatlong organs. Pag oily po ang sweat sa forehead, ibig sabihin po nun, collapse of yin. Only on nose, yun sa ilong. Damp heat in the lungs or stomach. Sabi nila silosa. Ang ibig mong sabihin, hindi ka silosa. May dump heat ka sa lungs at saka stomach, pag ilong lang. Pag sa arms and leg, stomach and spleen deficiency. Yun. Only on hands, deficiency of qi or yin of the lungs, or heart, or heat in the lungs or heart. So, pag kamay lang. Pag buong katawan naman po, lagi kang namamawis, lung qi deficiency. So, pag nasa palad lang, soles and chest, yin deficiency. Cold, 5 palm sweats. Yun po yun. Pwede na po yung screenshot yun. Time of day. In daytime, yang deficiency. At nighttime, yin deficiency. O, madali po nating tandaan, no? Kasi pag umaga is yang, pag gabi is yin. In some cases, it can also be from damp heat. So, yung condition po of illness, pag profuse cold sweat during a severe illness, collapse of yang. Oily sweat on forehead, like pearls not flowing, collapse of yang. Danger of imminent death. Nako, pag ano na po pala, talaga kailangan na natin magpagamot. Quality of sweat, oily. Severe yang deficiency. Yellow, damp heat. So, yun yung mga quality po, ano. Absence of sweating, hindi ka naman namamawis. Absence of sweating is also a symptom in Chinese medicine, an exterior invasion of wind. It is always important to ask about sweating. The absence of sweating indicates invasion of wind cold with the prevalence of cold. Hindi ka namamawis dahil may wind cold. And this corresponds to the greater yang stage within the 6-stage identification of patterns. The greater yang stage is always caused by the invasion of wind cold, of which there are 2 types. One with the prevalence of cold, in which there is no sweating, and the other with the prevalence of wind, in which there is sweating. So, pag may cold po, walang sweating. Pag may wind, ay may sweating. So, yun po yung pagkakaiba din, ano. Okay. In the other exterior condition, absence of sweating usually indicates cold or dampness in the superficial layers of the body. So, the space between the skin and muscles. So, exterior condition pa daw po yun. Pag wala kang sweating. Dahil sa cold or dampness. In interior condition, absence of sweating indicates a tight and excessive closed state of the space between skin and muscles. Coolly. This renders that person more prone to fever when invaded by a pathogenic factor, and also indicates that the person is more prone to full than empty condition. So pag interior na raw po, pwedeng maging full. Mas full ang mararamdaman, full condition. So, yun po yung ibig sabihin ng mga sweatings. Napakahalaga po nun. So, may tanong po, may dagdag.
Mukhang wala pa, makamamaya ng konti. Ang
Oo.
daming absent. Okay, anyway.
Opo,
Thank you,
po.
Ma'am Mildred.
Yes, Doc.
O, yung iba kasi wala daw signal. Ewan ko ano nangyayari. Okay, nasa ibang ano yata. Anyway, we will now talk about knotted pulse. Knotted, no? So how do we define knotted pulse? Ang pulse quality sa knotted, it refers to the rhythm of the pulse. The pulse is slow and stops at irregular intervals. So, pasulpot-sulpot, no? Clinical significance. Anong ibig sabihin ng knotted pulse? It indicates internal cold with stagnation of qi and blood. So pag may knotted pulse po tayo, it always indicates a heart disharmony. Okay? Although the rate and rhythm of the pulse are the same in all positions. So, knotted. Frequently seen in heart disease, katulad ng coronary heart disease, angina pectoris, rheumatic heart disease. Pwede din magkaroon ng knotted pulse after surgery. In young people, it signifies a constitutional deficiency of the original qi or severe deficiency of yang due to excessive physical work or excessive sexual activity during puberty. So kailangan natin i-differentiate between the knotted pulse with strength and the knotted pulse without strength. So dalawang klase po. Okay. Knotted pulse with strength. This indicates several conditions like severe chi stagnation from cold, chronic phlegm stagnating in the interior in old people. Alam niyo na siguro itsura ng tao nito. Retention of food, severe chi stagnation from emotional problems, blood stasis, abdominal masses. Knotted pulse without strength. It indicates constitutional deficiency. Walang strength na nga no? So mahina po yung original chi niya, constitutionally weak. Deficiency of kidney essence. So if you happen to have kidney deficiency na na-deplete na rin yung kidney essence, ganito po ang magiging pulse. So when can this happen? If you indulge in excessive sexual activity or a severe deficiency of yang. Common conditions presenting with a knotted pulse, we have heart disease, coronary heart disease, angina pectoris, and RHD. Basta puro heart issues. So check your pulse. Let us know kung knotted ba with strength or without strength. So summary, severe chi stagnation dahil sa cold. Can you imagine kung doon ka nakatira sa isang lugar na puro lamig, no? A chronic phlegm stagnating in the interior in old people. Kaya pag old na tayo, kailangan po tayo magpa-acupuncture and we need to get rid of the chronic phlegm. Retention of food, severe chi stagnation from emotional problems, blood stasis, deficiency of original chi without strength, deficiency of essence without strength, and heart disease. Combinations. Pag knotted and choppy, alam na natin pag choppy, blood stasis po yan. So knotted siya, tapos choppy, it could point to coronary heart disease. Kaya maghanap na tayo ng mga pasyente na may CHD. Should be knotted and choppy. Knotted and slippery, chronic retention of phlegm. Remember, phlegm is slippery, and this can point to rheumatic heart disease. Knotted floating, cold in the channels. Knotted deep, accumulation in the interior. Knotted wiry, a disease of the arteries or hypertension. So yung mga matataas yung blood pressure, you might want to check there if they have knotted and wiry pulse. Clinical significance in each position. Intermittent. So pag sinabi natin intermittent pulse, it stops at regular intervals. Regular po siya. Hindi katulad sa knotted pulse, irregular po yung intervals. Intermittent pulse may be rapid, slow, or normal rate. And pag knotted pulse, it is always slow. So how do you differentiate knotted pulse from slow pulse? Okay, they are both slow, but the knotted pulse stops at irregular intervals. Kaya ang keyword dito is irregular intervals. Heart disease po yan, kaya magpa-check na. Clinical significance in each position is not applicable because an abnormality in the speed or rate of the pulse will be the same in all positions. Any questions? Okay.
Clear, Doc.
Thank you very much. So check, sino dyan may knotted pulse?
Hard po yun. Maraming natin pulse.
Regular intervals, tapos slow. Mukhang titigil na sa papulsate. Diba? Okay, wala pa rin questions. We will proceed now to differential diagnosis. Medyo mahina daw internet ni Ma'am Nate, so she can't make it today. So let's ask again the help of Ma'am Mildred.
Yes po. Kidney Yin Deficiency with Phlegm. TCM Foundation 169. Kidney Yin Deficiency with Phlegm. Etiology. Long and chronic illness. Overwork, overwork over a long period. So yung mga may mga matatagalang sakit ito. Excessive sexual activity. Talagang bawal, sobra-sobra. Depletion of body fluid. Blood loss. Poor appetite. Rich in phlegm forming food. Yung kumakain ng mga matataba, mamamantika. Yan. And irregular eating. Kung kailan gusto kumain sa kakakain, yun po ang mangyayari. Nagkakaroon ng kidney deficiency with phlegm. Underlying accompanying pathology, kidney essence deficiency, kidney yin deficiency, spleen qi deficiency, retention of dampness. So yun po ang magkakaroon ng problema, yung mga organs na yan. Sign and symptom. So makikita po natin, laging parang may plema yung kanilang lalamunan. Tapos bouts of dry cough. Pag umubo, dry. Followed by expectoration of scanty sputum. So kahit gusto niyang magdura, hindi makakalabas, konti lang lumalabas. Breathlessness, nahirapan ng huminga. Feeling of oppression in the chest, parang namimigat na. Namimigat ang dibdib. At nahihilo din, nagkakaroon ng tinnitus. Yung parang nakakarinig ng ibang sound sa tenga niya. Hardness of hearing. Night sweating. So pag tinignan natin yung pulse, floating, empty, and slightly slippery. Kasi with phlegm, kaya slippery. Tapos deficient, kaya empty. So kung titingnan natin yung tongue, red with rootless sticky yellow coating. Kasi yin deficient. So kulang sa lamig. So ang gagawin po natin dito, treatment principle, enrich kidney yin. So kailangan nating palakasin, patasin ang kidney yin. At saka tanggalin ang phlegm, clear phlegm. So ang acupuncture treatment po natin ay REN4, supplements kidney yin essence. Spleen 9, supplements spleen. Nag-resolve din po siya ng damp. At syempre ang stomach 40, special points po ito, resolve phlegm, opens the chest. Needle with even method. Then kidney 3, supplements kidney yin and essence. Spleen 6, supplements spleen, resolve damp. Kidney 6, supplements kidney yin. So, yun yung mga points po natin na magpapalakas sa kidney yin. Thank you very much po.
Thank you very much, Ma'am Mildred. Okay, tuloy-tuloy tayo. From differential diagnosis, punta naman tayo ngayon sa acupuncture patterns and practice. Meron po tayong isang case study sa dementia. Okay? I hope everybody will, So before we go to the case study, summarize lang po natin yung mga patterns. Okay? So the first pattern is chi stagnation and blood stasis. The main points are DO20, extra head neck 1, GB12, stomach 36, bladder 17, spleen 10. And supporting points natin would be liver 14 for liver and spleen disharmony, REN 17 for chest impediment. Second pattern ng dementia, kaya kung meron po kayong kakilala na medyo may dementia na, no? So, medyo, try na natin i-categorize anong pattern. Turbid phlegm heat, obstructing orifices. Main points, liver 3, bladder 18, stomach 40, spleen 9, DO23, LI11, DO24, extra head neck 1. Supporting points, gallbladder 13 plus GB20 for manic psychosis. Stomach 44 for stomach fire, extra upper extremities 11 for loss of consciousness. The third pattern for dementia is marrow depletion. Points, DO20, extra head neck 1, stomach 36, GB39. DO16, bladder 17. Supporting points, Extra head neck 24 for insomnia and vertigo. Heart 7 for amnesia. O, diba? Heart 7, very effective. Dapat ngayon pa lang, wala pa tayong marrow depletion para mag-improve yung memory natin. Hindi tayo magkakademensya, kailangan na natin siyang i-tonify. The fourth pattern for dementia is liver blood and kidney Yin deficiency. So the points, kidney 3, spleen 6, bladder 18, bladder 23, bladder 52, do 20. Supporting points, kidney 7 for night sweats and edema, kidney 12 for essence deficiency. And the last pattern of dementia is spleen and kidney yang deficiency. So definitely the patient here would feel cold, no? Spleen 6, kidney 3, REN 12, do 4, REN 4, bladder 52. Supporting points, extra chest and arm 5 for middle chi sinking, stomach 27 for essence deficiency. So let's now go to the case study. Ang patient natin is a 58-year-old male na ang main complaint is apathetic facial expression. Apathetic, parang walang expression. Slow reaction for 7 years with aggravation for 3 months. So, baka merong nakaka-relate dito or para hindi ito mangyari sa atin, we should be very familiar with this case. Medical history. About 7 years ago, the patient gradually developed apathetic facial expression, slow in reacting to conversations. Kaya dapat masanay tayo mabilis mag-react, no? Dapat mag-comment. And events with discontinuous dizziness and forgetfulness. Inignore lang ng patient yung mga symptoms. So walang systemic diagnosis and treatment. So nag-aggravate yung symptoms. So, di ba? Are you happy? We can help people who have signs of dementia. No? In the recent 3 months, symptoms became more severe. Since the onset of the disease, yung mental state niya and sleep nag-deteriorate. Meron pang aversion to cold. Meron din siyang hyperlipemia for 15 years. And discontinuously took, so ibig sabihin hindi po siya tuloy-tuloy, simvastatin for high cholesterol, only to stabilize it in a normal range. So anong presenting symptoms ng patient? Slow in reaction, apathetic facial expression, declined capacity to calculate, low consciousness, poor spirit, slight obesity, or frequent urination and stools, reluctance to speak to others. So dapat walang may dementia dito, ha? Speak na tayo. When you look at the tongue, it's red with scanty coating and a thready and rapid pulse. So let's now go to the analysis. PE, temperature 36.5 degrees Celsius, pulse is 75, respiration 20, blood pressure 125/75. The patient walked independently into the ward and was cooperative. He spoke clearly, the answers were slow. So nervous system examination, cranial nerves negative, strength of muscle normal. Cerebral CT confirmed encephalotrophy. Examination for fundus oculi, this is the back of the eye, confirmed retinal arteriosclerosis grade 2. This is hardening of the retinal arteries. Grade 2. The patient was over 50 years old. Yung mga ano na dyan, nakaka-relate, or yung papunta pa lang. Due to malnourishment and overwork, the spleen and stomach were weak. So, pag mahina po ang spleen and stomach, nagkakaroon po tayo ng accumulation of turbid phlegm. Pag meron po tayong turbid phlegm, this will cloud the orifices. So, pati yung pag-iisip mo, hindi din maganda. Magkakaroon ka ng brain impairment. As the chi of brain is disconnected from the zang-chi, the brain marrow declines. So, pag nag-decline na po yung brain marrow natin, meron na po tayong apathetic facial expression, slow reaction, and forgetfulness. Kaya dapat nag-aaral ng TCM, di ba? Location of the disease is in the brain, closely related to dysfunction, paulit-ulit na lang, heart, liver, spleen, and kidney. Pag pupunta ka sa iba, doon lang nakafocus sa utak. No? So pag sa atin, we're going to look at the heart, liver, spleen, and kidney. So we have a deficient root and excess branch. TCM diagnosis, dementia due to turbid phlegm, clouding the orifices. Western medicine diagnosis, dementia. Treatment, pathogenesis is malnourishment with spleen and stomach deficiency. Kaya dapat nga no, nagmumoksa tayo. Sa totoo lang. But nobody is still, dapat wala pa tayong na ano. Sino ba dito ayaw magkaroon ng dementia? Wala yatang gusto mag-alaga ng may dementia. Ha? Okay. So, spleen and stomach deficiency engendering turbid phlegm. This will cloud the orifices and obstruct the brain. So, magkakaroon po tayo ng declined brain marrow and mental activities. So, what are the principles? Very easy. I-solve natin yung root cause. Identify. Fortify the spleen and remove dampness. Eliminate phlegm and open the orifices. Okay, so any questions po? Any comment, Ma'am Mildred? Are you...
Ang hirap pala, Dok, magka-dementia. Kaya dapat ngayon pa lang habang may matapa-tapa, alagaan at magtusok na.
Kaya nga pwede ka magka-dementia pag marami kang phlegm. Nakita niyo yung
Yes
puro
po.
tululawan.
Oo nga po.
So, magtulungan po tayo. Let's form a team that will educate people. Let's reach out to more para mas mura. Huwag naman tayong Siyempre, pag nakita natin yung pasyente di naman kaya, di gamutin na natin, di ba? Para marami
Kasi pwede namang i-prevent pwede nating ma-prevent na hindi lumala.
Oo.
Kung ma-educate.
True. So imagine, tinan mo, tininan yung tongue. No? Pulse. Educate. So let's spread. Kaya nagpapasalamat kami kahit yung iba walang signal, andun pa rin tayo. Siguro kahit dalawa lang tayo. Usap pa rin kami.
Pero napapanood naman po nila sa YouTube, do. Kaya yung
Yes.
malaking tulong.
Oo. Actually, sikat na si Ma'am Mildred. Parang hinahanap na daw yung nila. No?
Salamat po. Makatulong
marami
tayo.
po kasi tayong mga Pilipino na nasa ibang bansa. And I think kasi nakikita nyo naman makikita nyo ilan yung views. No? Maraming salamat po. And we still welcome more volunteers kasi it is only through volunteering na we can show the world that we really care, right? And we all learn from your presentation. So after, nakakalungkot dementia, wala yatang, helpless dyan po ang medicine, Western medicine. So maaga pa lang, dapat may ginagawa na tayo. Tingnan ko may phlegm, turbidity. Okay?
Walang magagawang modern medicine, Doc, pag dementia.
Wala. They will not look at the spleen and stomach. They'll find it a bit odd, a bit off. Diba?
Kahit painumin ng mga vitamins, Doc? Diba? Kasi may mga pinapainom na vitamins.
Lalong yan. Kasi pa rin, they have to have acupuncture treatments on a regular basis. Okay, so let's help spread the gospel of acupuncture. And I hope everybody's enjoying this. Okay, punta na po tayo sa throat. May klase daw po si Sir Alvin. Mukhang hindi siya makaka-represent. Can we request Ma'am Mildred, please?
Yes, Doc. Pakiawin na natin, Doc. Sign and symptoms, 52. Redness and erosion of pharynx, swollen tonsils. Po natin ang mga swollen tonsils. Redness and erosion of the pharynx. Full. Heat in the stomach and intestines. Erosion, swelling, and a yellowish red color of the pharynx. Burning epigastric pain. Thirst, sour regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, red tongue with a yellow coating, overflowing rapid pulse. So puro heat po yung sign full. So ang gagawin po nating acupuncture points ay stomach 44. Alam naman natin stomach 44, iyan po ay water points, kaya papalamigin po niya yung mga heat sa stomach. At large intestine 11, stomach 43, large intestine 4 para expel niya yung damp heat, and lung 11. So yan po yung mga pwede nating gamitin na acupoints para mawala ang heat in the stomach and intestines.
Attend po kayo mamaya ha, 5 shoe points. We're going to show the video, then we're going to discuss. Kaya para malaman natin bakit ginamit ni Ma'am Mildred yung water points, di ba? Thank you.
Opo. So, empty and full. Lung yin and stomach yin. Deficiency with empty heat. So, pag deficiency ng yin, so mas mataas yung heat. So, chronic erosion of the pharynx that comes and goes. Slight swelling. So, may dry mouth po siya and throat. Nakakaramdam siya ng thirst with desire to drink and small sips. Konti lang pag umiinom siya. Tapos pakiramdam niya talaga, mainit, lalo na sa evening at namamawi siya sa gabi. Tapos yung 5 palm heat, yung kanina po na-discuss natin, yung mga palad, noo. Red tongue with coating, floating, empty, and rapid pulse. Kasi nga heat, kaya rapid. Other symptoms and signs depend on the organs affected. So, kung may iba pang organ pong affected, makikita natin, diba, affected yung kidney, may makikita tayong problem.
Red tongue with no coating
stomach,
yan. That's red tongue without coating, no?
Without coating, dahil full empty. So, which may be stomach, lungs, or kidney. Lagi po siyang maapektuhan gawa nung siyang cycle, nagpapasa niya ng mga pathogenic factors, yung mga sanhi ng sakit, ipapasa sa katabi niya mga organs. So, ang acupuncture point po natin gagamitin is lung 7, na nagpapalakas ng lungs, with kidney 6, directing vessels, lung 9, ren 12, spleen 6, stomach 36. So, dahil yung mga organs pong affected, ayan, pinalakas po natin, kaya ginamit natin yung mga points. Other patterns po, makikita na natin tong toxic heat. Pag toxic heat po, mayroon siyang redness, erosion, swelling, and severe pain of the pharynx. Mamagang tonsil with yellow purulent spot, sore throat, fever, thirst, headache, red tongue with red points, and thick, sticky yellow. Talagang full heat siya, sticky yellow coating. Overflowing, rapid, slippery pulse. So, lahat heat yung makikita natin dahil siya ay toxic heat. Severe Yin Deficiency. Napakababa na po nung yin. So, makikita natin ay chronic erosion of the pharynx that comes and goes, no swelling. So, dryness of the pharynx with grayish ulcer. Tapos, dry throat. Thirst with a desire to drink any small sip. Konti lang, gusto lagi nababasa yung lalamunan. So, mayroon din siyang pamamawi sa gabi, feeling of heat in the evening. Siguro kahit malamig po ang panahon, pinapawisan to. Nagkakaroon siya ng feeling of heat. Tongue, dry without coating. Deficient kaya without coating. Tapos ang pulse po, floating empty. Halos hindi nararamdaman. Other symptom and sign depend on the organ involved, which may be lungs or kidney. So, yun. Ipapasa na naman doon sa mga katabing organ. Pwede pong magkaroon din ng karamdaman yung organs na yon. Blood stasis with phlegm heat. So, chronic erosion of the pharynx with ulcer with raised hard edges. Dark, dull color of the pharynx, sore throat, mental restlessness. Pag may stasis na po, yan, hindi na mapakali. So, mayroon din po siyang abdominal pain, feeling of oppression of the chest, sputum in the throat, feeling of heat, thirst with no desire to drink. Nauuhaw pero ayaw mo uminom kasi nga may mga stagnation. Reddish purple and swollen tongue with sticky yellow coating. So, makikita mo na rin po, hindi lang siya red, kundi may purple na. Pag tinignan natin ang kanyang pulse, wiry, slippery pulse. Ito yung ating makikita. May stasis Ito na, number 5 po, swollen tonsils. So, yung mga namamagang tonsil. Pag full condition po, ito ay invasion of wind heat with toxic heat. So, pag full, karaniwan, may acute swelling and redness of the tonsil. In severe cases, osing pus, parang may nananana po pag tinignan natin yung ilalim ng lalamunan. So, severe sore throat, aversion to cold, fever, cough, stuffed or runny nose, with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue is slightly red on the side, in the chest area or in front part. Ang kanyang pulse po ay floating rapid pulse dahil heat nga. So, ang pwede po natin gamiting acupuncture points, large intestine 4, triple burner 5, bladder 12, lung 7, large intestine 11, and lung 11. So, yan po yung mga points na magpapalamig, magpapalakas sa chi. Toxic heat in the throat at the chi level. Nasa chi level pa lang po siya. So, ang makikita po natin, acute redness and swelling of the tonsils. Ganun pa rin, pamamaga ng tonsils. With O's pus, yung may mga nananana po tayong na parang maputi. Severe sore throat, difficult in swallowing, masakit po talaga yan. At saka nagkakaroon ng high fever. Tapos, nauuhaw. Siyempre, dahil marami kang heat, may mental restlessness, a feeling of heat. So, kung titingnan natin ang tongue, red tongue with red points and thick, dark yellow coating. Talagang sobrang init po yan. So, kung titingnan din naman natin ang pulse, overflowing, slippery, rapid pulse. So, ang acupuncture points po natin, stomach 44, yun uli, water points to cool down. Stomach. Lung 10, lung 11, large intestine 4. So, yun pong ating gagamiting mga points. So, pag toxic heat naman po sa stomach and intestine, ang gagamitin po natin ay chronic redness and swelling of the tonsils, yung pabalik-balik ng namamagang tonsil. So, may pakiramdam po siya na nauuhaw, thirst, foul breath, kahit wala siyang sirang ngipin, bad breath siya. Pag lumapit sa at nagsalita, maaamoy mo po yun. Burning epigastric pain, thirst, sour regurgitation, nausea, excessive hunger, laging parang gutom, a feeling of heat, constipation, red tongue with yellow coating, overflowing rapid pulse. So, yun po yung mga sign ng heat in the stomach and intestine. So, uli po gagamitin natin ang stomach 44. Kasi nga, very effective yan, water point to cool down the heat in the stomach and intestine. Lung 10, lung 11, large intestine 4, and large intestine 11. Empty full. Pag empty full naman, stomach and lung yin deficiency with empty heat. So, makikita natin dito yung chronic swelling and redness of the tonsils. Ganun pa rin pa, no? Chronic. That come and go. Pabalik-balik. Nakakaroon siya ng dry cough or with scanty sticky sputum. Parang yung gusto niyang dumura pero konti lang yung lumalabas. At saka malagkit. Pati yung kanyang mouth is dry at throat, especially in the afternoon. Thirst with a desire to drink and small sip. Dull or burning epigastric pain. So, pakiramdam niya ay laging mainit sa hapon. Nagkakaroon ng night sweat sa gabi. At yung 5-fan heat. Nagdudugo na rin po. Minsan nakakaroon sa pagdurugo ng gums kasi nga may heat eh. So, ang tendency ng katawan, i-release ang heat through blood. Lalabas yung nagdudugo. Tiredness, malar plus, then body, red tongue without coating. Ang kanyang pulse ay floating, empty, and rapid pulse. So, tusukan po natin ang lung 7, kidney 6, lung 9, ren 12, spleen 6, stomach 36, lung 10, and stomach 44. Yun po yung ating mga pipiliing points para mawala ang empty full heat. empty or full heat. So, in my experience, a chronic swelling of the tonsil in children denotes a residual pathogenic factor, usually dampness. Heat in the stomach and large intestine may also cause a chronic swelling of the tonsil in the children. So, yun po. Siyempre kasi nga kung mainit yung stomach mo, through siyang cycle, dadalhin niya sa lungs. So, yung lungs, ang may ano po dun sa ating tonsils, sa ating lalamunan, doon niya dadalhin yung mga heat. So, yun po yung nangyayari. May tanong po.
Wala pa rin.
Ma'am
Okay.
Ana, baka po may share kayo, Ma'am Ana. Hello, Ma'am. Nagluluto si Ma'am.
Okay. So siguro we can
Thank you
proceed
po.
to the, thank you Ma'am Mildred. Punta na tayo sa asthma. This is the second installment ng ating lecture sa asthma. Allergic asthma in Western medicine, and we shall talk about etiology. Okay, traditionally, asthma was divided into early onset type and late onset type. Pag sinabi mong early onset type, this is called extrinsic asthma. Ibig sabihin yung etiology is allergy. The late onset type of asthma is also called intrinsic asthma. So this is non-allergic etiology. However, both early onset and late onset, or extrinsic and intrinsic, are characterized by the presence of eosinophils in the bronchi. Pwede nating i-classify ang asthma into different clinical endotypes depending on the type of airway inflammation and key mediators involved. An asthma endotype can encompass various phenotypes. So this will elicit different types of responses to drug treatment and prognosis. So meron tayong several endotypes that we can identify for allergic asthma itself. Pero yung discussion natin will only be focused on the allergic early onset type of asthma. So early onset asthma, ibig sabihin maaga dumating. Starts during childhood. Yung late onset asthma starts later in life. Not all cases of early onset asthma are due to atopy. Not all cases of late onset asthma, atopy allergy. Not all cases naman ng late onset asthma are intrinsic or non-allergic. Although it is not common, allergic asthma may occasionally start late in life. Asthma that starts during early childhood is not necessarily atopic asthma. So an early onset, hindi lang po ito yung only criterion for defining asthma as allergic or atopic. Yung familial incidence, connection with eczema, and the typical whealing skin reactions on inhalation of allergens, these are important features na kailangan to be able to diagnose atopic asthma. Pero po tayong rare cases of asthma na nag-i-start sa early childhood na walang allergic basis. Okay, so this happens when a small child suffers from URTI, upper respiratory tract infection. So this is invasion of wind cold or wind heat. So it could be due to the fact that it was not treated properly or binigyan mo lang ng antibiotics. So if wind is not expelled properly, naglalodge po siya sa lungs, and so this will impair the diffusing and descending of lung qi. So ano mangyari? You will have breathlessness and phlegm. Yung presence ng wind and phlegm sa lungs, this will predispose the child to further invasions of external wind. So this will make the situation worse. So nagkakaroon po tayo ng vicious cycle. So yung child is progressively weakened, and pag weakened siya, mas prone siya to invasions of external wind. So lalong palala ng palala. Some patients, some parents kasi would think, ay may maintenance siya. Pero hindi pa nila iniisip, palala ng palala. Okay, many cases of what is essentially retention of residual pathogenic factor, like the phlegm, following repeated invasions of wind in small children, are diagnosed as asthma. And ang binibigay, steroid, cortisone inhalers. Oh, yan, very concerning yan. Ang asthma daw, sabi ni Giovanni Machocha, is often wrongly diagnosed in small children, which are actually suffering from bronchiolitis. Okay? So, yung symptoms po ng bronchiolitis, a viral infection, closely mimic those of asthma. So, ito po yung characteristics. Starts during early childhood, appears to run in families. Meron pong eczema from birth. And they have weak whealing skin reactions to common allergens. That is often associated with allergic rhinitis. They also have antibodies in their serum, so that could be transferred to the skin of non-sensitized people to cause the same whealing skin reactions. Okay? So I think this says it all. Magastos po talaga pag ganito. And pag hindi po nagpa-acupuncture, hindi man lang nag-ear seed acupressure or gua sha, wala rin mangyayari. Kaya spread na natin yung ating mission. So as for the increased incidence of atopy, it is difficult to pinpoint the causes. Pero maraming mga hypotheses that were advanced. Una is the hygiene hypothesis. Sinabi dito, meron po daw increased incidence of atopy due to lack of infections in childhood. Yung masyadong malinis. No? Do you believe that? Yung masyado ng malinis. So, dahil sa sobrang immunizations. No? And kaya mas okay pa yung nakikipaglaro ka. Dumihin mo yung sarili. So, kung hindi ka nagka-infection ng childhood ka, so wala kang reserve. At birth, infants destined to become allergic, they have impaired production of interferon gamma by their circulating T lymphocytes. Okay. A possible explanation of protective effects of exposure to bacteria in early life when sensitization occurs is their action to increase production of interferon gamma. So, itong concept na to, this gave rise to the hygiene hypothesis, in which yung changes na infant diets, early use of antibiotics, reduced exposure to bacterial products, predisposed to the persistence of the T responses in childhood. Kaya dapat dumihin mo, no? Makihalubilo ka naman sa mga ibang bata. Do you agree? So this is a subject of our discussion later. Yung clean living conditions sa mga Western societies, by reducing the incidence of infection, this may weigh the balance toward the Th2 phenotype, and this will predispose to asthma. So meron naman another study, hypothesis niya, that growing up in a more hygienic environment, so masyado kang rich kid ka, hindi ka na-expose sa mga mikrobyo. See, this may increase atopic immune responses and thus the development of asthma. Pero hindi po daw ito na-confirm ang hygiene theory. Although low endotoxin concentrations in the air in industrialized countries have been found to favor asthma development. Another factor is antibiotic exposure. As much as possible po, wag nating, wala tayong magagawa kasi negosyo yan, di ba? So, kawawa. Although further investigation is needed to confirm this hypothesis, since, syempre, binibigay yung antibiotics to treat respiratory infections, and kasi yung infections na yon can trigger asthma symptoms. So yung mga patients with allergic asthma, inhalation challenge with an antigen produces immediate bronchoconstriction, reaching a maximum in 20 minutes. This early asthmatic response is almost identical in time course to the wheel reaction, since, as already said, they share the same pathogenic mechanism, yung type 1 IgE mediated immune response. Okay, so this would show na yung primary etiologic factor ng allergic asthma is indeed the allergic reaction rather than the inflammation process that follows the allergic reaction. So marami pong mga allergens were implicated, but the main ones are fecal particles of house dust mites. Ano ba ito sa Tagalog? Yung mga una, no? May mga lisa, no? Mga house dust mites. Pollen, fungal spores, feathers, animal dander, and cat saliva. Yung mga mahilig sa cats. I have a friend, he has 36 cats, and his asthma would always, ewan ko, mas gusto pa niyang tumulong sa mga cats. Can you imagine? And he would always complain, umaatake yung asthma niya. Okay.
36 dog na cat?
Yes. Do you want to meet him?
Oh,
Parang siyang mukhang cat.
grabe.
As in. Okay. Once the mast cells have been primed by exposure to these allergens, and then magkakaroon po ng high levels of IgE, immunoglobulins, they also become hypersensitive sa ibang non-specific allergens. Kaya kung napapansin nyo, pag allergic sila sa mga feather ng mga hayop, ng mga cats, minsan dogs, allergic din sila sa smoke, tobacco, petrol fumes, dust, atmospheric pollutants, and perfumes. Occasionally, an allergic reaction in the bronchi pwede pong ma-elicit by ingested allergens from food, such as shellfish. So, ang daming bawal, no? Fish, eggs, milk, yeast, or wheat, which reach the bronchi via the bloodstream. Ang viruses, kasama na dyan si COVID, may also act as allergens. That is why an attack of allergic asthma may be triggered in a child by a viral infection, the most common ones being the RSV, respiratory syncytial virus, and the influenza virus. Actually, pinaganda lang yung pangalan. Simple lang yan. Pang ano lang yan. In contrast to normal subjects, na nag-demonstrate po ng plateau of bronchoconstriction following histamine production, no matter how high the dose, patients with asthma do not show such a plateau. So sa mga pasyenteng ito, inflammation of the air passages following either provocative like histamine and methacholine or non-specific like tobacco smoke, exercise, atmospheric pollutants, cold weather, they induce bronchial hyperreactivity. So aside from airway inflammation, yung mechanisms responsible for bronchial hyperreactivity, meron ding genetic and environmental factors. Kung meron kang defects sa airway smooth muscle, as well as airway remodeling and obstruction. So sa point of view naman ng Chinese medicine, di ba, simple lang. If you want to restore the normal bronchial reactivity, you have to do tonification of the lungs and kidneys, whereas bronchoconstriction may be regarded as a wind invasion. Are you happy? Okay, questions po?
Doc, may isi-share po ako dyan sa asthma.
Please,
Kasi ang laking
go
tulong
ahead.
talaga ng acupuncture. May pasyente po kami noon na 3 days ng comatose sa hospital. Tapos inihintay, nagpa-purple na yung mga kuko po niya. Ngayon po, sabi ng doktor, wala na silang magagawa. So, pero yung family nag-decide na alisin doon sa hospital, ihanap na ibang hospital. Tapos kami po ang nilapitan, habang nasa, may kasama po akong doktor. Kasama ko po yung doktor namin sa clinic.
Okay.
Habang pong nasa ambulance, inacupuncture po namin kasi talagang 3 days na, nangingitim na, iniiyakan na. Itinakbo po namin doon sa another hospital, 4 hours ang takbo eh. Habang nasa po kami travel, bundok-bundok po yun, rough road. Inacupuncture po namin. After 15 minutes, nagkamalay. Pagdating nung po sa hospital na pupunta namin, dineretso pa rin namin sa emergency room, kaya lang naglalakad na yung pasyente. Kaya pagdating doon, kinect up lang po siya ng yung heartbeat niya, nag-normal lahat, nag-normal. So umuwi na kami. Kaya laking tulong ng acupuncture na makabuhay ng pasyente. Yun po, na-tonify yung lungs, heart, nabuhay. 3 days comatose.
So I hope everybody is serious enough to consider acupuncture as a career. No? Kasi halata naman si Ma'am Mildred, grabe yung enthusiasm. Ito yung talagang taong gustong tumulong ng tao, no? Yun.
Yes po, kasi sa karanasan po na matagal na tumutulong mag-acupuncture, marami pong nakapaglakad, maraming malapit ng mamatay na nabuhay pa kasi hindi pa nila panahon pwede nating tulungan.
Opo. Kaya in-encourage namin ng mga OFWs na gusto ng mamalagi dito sa atin to consider enrolling in our class, no? So yun.
Kasi pag natuto po sila, maraming matutulungan, mas marami
Opo.
tayong nanggagamot, maraming mas magandang kalusugan, mas maraming magagawa sa pamilya, sa
True.
community.
So maraming salamat po. And any questions before we end? Any questions, sir? Ay, nawala bigla si Sir Majin. Okay, busy yata. Anyway, wala ang problema because they will always watch this on YouTube. Okay, so with that, maraming salamat po kay Ma'am Mildred na mararamdaman mo talaga yung enthusiasm, yung willingness to help other people. Sana po kayo rin, no? Let's continue spreading the gospel of acupuncture. Gawin nating parang, gawin nating maintenance sa mga tao. And we need to educate them po. Education is very, very important. So with that, by the way, we would like to invite all of you mamaya, 8 o'clock, dinner muna tayo para sa 5 shoe points. So we're going to have 8 sessions for that. So we're going to show you the video first, and sana lahat will open their mics to share their experiences. Okay? Maraming salamat po, and see you later at 8 o'clock. Good evening po.
Thank you po.
Thank you. See you later.
Bye-bye. Thank you. Mamaya ha.
Bye. Yes po.
That's 60 points. Thank you po.
Thank you. Bye-bye.